Good evening, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. We are coming to you live from Houston, Texas. Welcome to COVID World News. COVID-19 pandemic 2019 and 2020. Today, my special guest is Niranjan Nikam from Bangalore. He's a journalist and he's going to talk to us about what's happening in India and what we can expect in the coming weeks and months. Before we begin with that, I would like to give an overview of COVID-19 all around the world, here in the United States, and what we have learned. And we're going to look at some charts from India and have Niranjan Nikam, explain to us as what is happening in India. So to start off, you're watching a Triple N News coming to you from Houston, Texas. I am Dr. Nik Nikam, your host. All right, as of yesterday, there were 6.2 million active cases of coronavirus in the entire world, with more than 370,000 people having died and 2.8 million people having recovered from the coronavirus infection. If you look at the graph here, this is the world graph showing almost 100,000 cases or more per day. And a lot of this may be related to the spread of coronavirus infection. Some of it may be related to increased number of tests being done all across the globe. And here are the death charts, which are showing a steady decline in the number of deaths. This is the world coronavirus chart. And now we're going to look at some of the important regions in the Western world. As you can see, in the United States, we had 1.8 million people who have tested positive, and the numbers are rising at a rate of 20,000 cases per day, with a total mortality of 106,000. And in US, we have done almost 17.6 million tests. Similarly, some of the hotspots across the globe are Brazil, Russia, Spain, and even India falls into that group. And maybe Niranjan can explain to us as what's happening. And UK is also having a pretty high mortality. So let's move on to the next part. And we're going to look at India now, with the 190,000 cases of coronavirus, with 5,400 plus deaths, and 91,000 having recovered. These numbers are very, very small fraction of what the number of cases that have been seen in the UK, Europe, and in the United States. And this is sort of similarly, it sort of falls in a similar line as most of the Asian countries and East Asian countries, and we'll see what's the difference that has made in these countries. And before we go into further details of Indian outlook, I want to walk you through the epidemic graph. It is called the FOR curve, or the bell curve, of the rise and fall of the number of cases, number of deaths. And this is coming from China and from the Hubei province. We can just pay attention to the overall contour of the graph, because this has a very significant importance when we get to India and see where does India stand and what do we expect to see as time goes by. As you can see, in the middle of January, the epidemic in Wuhan started, and it rose very rapidly within a couple of weeks and reached a peak. Then it had a plateau for almost a week, and followed by that, there was a steady decline in the number of cases until it came down to which is negligible. The most important point I want to make here is it took only about 2 weeks or so for this graph to rise all the way to the top, but look at how long it took to come down to reach a bottom level. So this is an important point we want to keep in mind. It takes like 2 to 3 times longer for the number of active cases or the deaths or hospitalizations to come down as it takes for it to go up during the early phases of the COVID-19 epidemic. Now let's look at keeping that China's Wuhan graph in mind, and here is a graph showing New York City, or New York State, and New York State sort of parallels what we see in the Wuhan and China graph. In the New York, it started somewhere on March 4th, and it reaches a peak towards the end of March. So we're talking about like 25, 28 days. And from there, it has taken more than 2 months. So it took about a month to go up, or 3 weeks, and it has taken much longer, like almost 2 to 3 times longer to come down. Keeping these two in mind, now let's look at the graph from India. It started somewhere on March 4th, which is similar to what was happening in New York City. And given the population of 1.38 billion people, the number of cases we are seeing in India, as I told you, is a fraction of what we have seen just in New York alone. But nonetheless, what's really interesting here is the graph is continuously climbing, and it hasn't seen a top. And after that, we have to see a decline, which I said is going to take 2 to 3 times longer than what it takes for it to go. So this is an important point for India to keep in mind, that we are comparing to the countries that have already gone through the early phases of this epidemic, like China, Wuhan, and New York City in particular, which was the epicenter of the corona epidemic in the United States. So let's keep this in mind, because this is what's going to help us to decide what to look for in the future. And here are some of the countries which are in the lead pack right now as we speak: Brazil, Peru, Chile, Mexico, India, Saudi Arabia, Russia. They are all on the upslope as far as the number of cases are concerned. If you look at the graph from Russia, and if you look at the graph from India, which is 135 green, which is 158,000, there is certainly a difference. And this is like a pretty steep curve, which you usually see in places where there is not strict like lockdown, something like that. In India, the graph is much flatter, and that's a good sign. But at the same time, it also helps us to understand how long it's going to take for this graph to come down on the downslope. All right, and here are the New York cases, which I just showed you. And the point I wanted to make was, this is how long it took for it to go up. And look, it has taken more than twice that time to reach the bottom, and it hasn't reached the bottom yet. Here's 2,500 cases per day. So it's roughly around like less than 1,000 cases in New York per day. All right, so these are the deaths in India, which are of a much smaller magnitude compared to New York City, where they used to have, more than 1,000 deaths each day. Okay, let's keep that. And here's what's happened to the economy before the coronavirus came. And Niranjan can expand on what's going to happen to the Indian GDP as the graph continues to slide from almost 2016, where it peaked at 9.7. And just before the corona crisis started, it was like 3.1. Okay, and within the country, within India, there are several hotspots, especially Maharashtra, Delhi, Tamil Nadu, Telangana, and Uttar Pradesh. And as I was doing the research, I found out Bangalore, where Niranjan Nikam is from, has the lowest number of cases and lowest mortality. It just stands out distinctly different from most of the major cities in the country, even though it's supposed to be one of the third or the fourth largest city in India. So that's some of the things. Now, keeping that in mind, I have several questions to Niranjan, and here are a long list. Niranjan is a journalist, and you may not know, we went to school together back in, I don't know what, 50s, 60s?
Yeah, 60s.
It's been
You,
so
you know,
long, I lost track of what was
yeah.
happening. So now here are some of the questions. How effective was the lockdown of 1.38 million people? Tell us
Billion.
about, okay, go ahead.
Yeah. So, good morning, Dr. Nikam.
Sure.
As usual, it's always a great pleasure interacting with you. And
Yes,
of course, you didn't mention that we are first cousins.
that's right.
Yeah, we are first cousins. So, how effective was the lockdown? Let me just go back a little. You
Yes,
know, because the first time I heard the word coronavirus was way back in November when I read it in the newspaper.
I see.
Then I was thinking, somehow I didn't like the word. I don't know why I didn't like the word. I didn't like it. So I didn't pay much attention to it at all. Then by December, then the things started happening. And then January, then we had the first case of the coronavirus in India with Kerala reporting. And then we had the first death in Karnataka in a district
Mhm.
called Kalburgi. So then all of us suddenly started waking up to what is happening. Uh, Again, we thought, because earlier you had all those other viruses like the Ebola, the SARS, and many others. So we thought this could also be one thing that comes from China. So there is nothing much to really worry about. But then it suddenly in March, it started exploding in our faces. And then, of course, with a country, of 1.38 billion people, we thought we are going to, be in real trouble. But surprisingly, as you have said, we have just 198,370 cases as of June 1st or 2nd, and with a death of just 5,608 people, and more than 95,554 have recovered in the same time. So
Mhm.
this is something that everybody is surprised about it. But what is most important is on 24th evening, suddenly our prime minister, in
Mhm.
the did the lockdown in just 4 hours. So everything came to a standstill. Now, whether the way that it was implemented is good or bad, only time will tell, because we just don't know. There are many things happening. Yes, we have been able to control, and that is what the statistics, the figures say, that because in India, when compared to most of the countries, of course, Dr. Nikam, in your own US, I don't know what is happening there. It's crazy, and how a city like New York, and being what it is, so many people have died in New York. So it's all very confusing. Everything is confusing today, because see, coronavirus we thought is a science fiction. There is no way we could have ever imagined that an invisible virus would suddenly come and strike the whole world, and
Yeah.
it could bring the world to a grinding halt. This was a pure science fiction, and there are many movies that have been made. Contagion is one movie that I saw.
Yes.
It was almost same. What has unfolded today is what was shown in that movie, which was made in 2011.
Yeah.
Amazingly, these are things. So I don't know what it is, whether we should how much of science fiction will become reality in the future is what it is, Dr. Nikam.
It's interesting. You do talk about lockdown having a significant impact, maybe in terms of the number of cases, the number of deaths, and to contrary to that, within India, you had so many religious gatherings which were having a different outcome altogether. Maybe you can highlight on that one.
Yeah, see, this see, India being a country with diverse religions, and as they say, we have unity in diversity. But things are not as good as they were. Let me be very frank about certain things, Dr. Nikam, because
Hmm.
we can't hide the reality. The fact remains that, we have, as I said, many religions in this country. There is, of course, the majority religion, the Hinduism, then Islam, then Buddhism, Jainism, Sikhism, so all kinds of religions, and we all have lived together in real harmony, except exceptions apart. But the religious gathering now with the coronavirus has given a different turn and a twist to the whole thing, and the way we are looking at things. For instance, when the first, let us be open about it. It
Yes.
was the Tablighi markers. So we suddenly saw this some vague, sect. It's a
Yes.
sect. So it's a sect. None of us had heard it till now. Absolutely nobody was aware of a Tablighi Zaman
Yeah.
Markaz, because nobody saw this. Of course, we know Islam. There is Sunni, there is Shia. Then there are so many other factions in the same religion. But Tablighi was something that came just like that. And so in Delhi, when this happened, when there was a gathering and suddenly they came out, and then the targeting happened, the finger pointing happened. And so obviously the Tablighis were the first who were tested. And because they were tested, and being what it is, and a lot of people in that community obviously scared, because what little I read of Tablighi was, they are not out to convert anybody. They are just there doing their work. They say, they just go to their own community people and say, this is what Islam is. You should not, come away, move away from that. These are the things that you need to follow. This is what that small community was doing. But suddenly you had this targeting being what it is now. People were targeted. And so obviously when they were tested first, it so happened that that they were called the super spreaders. Now, was it really true? We don't know, because we did see many other community. For instance, in Karnataka, there was a chariot fair where thousands of people gathered. So there were many other gatherings that were happening at the same time.
Even I heard there was like a Sikh gathering also.
Yes,
In
gathering.
Punjab or Rajasthan, where
But see, the Sikhs went to Nanded. There is a Gurudwara there. So many of them got stuck in Nanded in Maharashtra, where now the maximum number of coronavirus cases have come. It is the country, in fact. So what happened when they had to go back to their hometowns, the Punjab? A lot of people went, but they unfortunately, most of them started testing positive when they reached there. About 3,000 plus people. So the blame game started between the chief ministers of Punjab and Maharashtra. The Punjab chief minister said that you should have tested them and sent to us. But these people said, no, we have told you that they are coming. So all these kind of things are happening in our country today. The blame game.
I think it sort of correlates with the nursing home cases. And we saw a large number of, like more than 50% of the population in a nursing home, where they were all congregated in a small, closed place. They all tested positive. And one of the reasons, there are several explanations, but I would like to hear from you about India. The reason New York City got really hit hard was because of the population density, which is like 47,000 plus people per square mile. And as you know, New York has high-rise apartment complexes with very small places, a lot of sharing of the elevators, the hallways, the passages, and so many other things, which made it a perfect breeding ground for a virus like coronavirus. Okay, let's proceed. Go ahead.
Yeah, see, it's good that you talked about New York, because New York and Bombay, Mumbai,
Yes.
they are two comparable cities. Of course, since you say the density per square mile in New York is more, but Mumbai has one of the largest slums called the Dharavi, where, per square kilometer, I don't know how many, it is huge. In a 2 to 3 square kilometer area, there are lakhs of people living in that area, in that small place, where cheek by jowl, as they say. There is absolutely no place. It is a tragedy of our nation that we have a slum like, the Dharavi still, in spite of us calling that we have gone somewhere and all that. But Dharavi happens to be the epicenter, which we all knew that once it hits Dharavi, then you don't know how it's going to explode. So that is exactly what has happened.
So the slums have not only become famous for the Slumdog Millionaire movie, which was very popular all across the globe. Now the coronavirus has put the slums in the world map again.
So see, these are the problems that a country like India faces. But still we have a long way to go about all these things. So so Maharashtra was the place now which has taken the lead as far as the coronavirus COVID-19 infections are concerned. Then there are other states in the country. Maharashtra with 72,300 cases and 2,665 deaths, followed by Tamil Nadu, Delhi, Gujarat, Rajasthan, Madhya Pradesh, Uttar Pradesh, Bihar, Andhra Pradesh, and where I live. Actually, I now live in Mysuru, not
Mm.
Bengaluru, because I have moved to my own hometown where you and I were born.
Yes.
So, where Karnataka is in the 10th place,
Yeah,
3,790.
I put the graph here
Yeah,
of all
yeah, yeah,
the
yeah.
hot spots
So,
in
so,
India.
so again, why is how is Karnataka? As you were talking in your introductory remarks, Bengaluru is the third or fourth largest city. It's
Yeah,
especially
tech
called the IT
capital.
capital. The IT
Yes.
capital. So, but how is it that's in spite of all this, Karnataka has managed? Maybe because we have a good healthcare. So that is one thing. We have very good hospitals. The government of Karnataka somehow has done a very good job. In fact, if you take my own city where I live now, Mysuru, you hardly have, almost 100% zero cases in where I live, Mysore. The
That's
kind
amazing.
of, it is amazing, because simply because, see, Mysuru, where I live, doesn't have any migrant population, not too much. Then the international tourists are not there so much. But Bangalore, with the kind of population it has, so there also somehow the doctors have done well. The administrative the administration has done really well, both in Karnataka, I mean, both in Bengaluru and Mysuru, and in several parts of Karnataka.
Well, since you mentioned Mysuru and Karnataka and the doctors, I have to let the listeners know I went to Mysore Medical College and I worked in the government hospitals, KR Hospital. Is it still called
Yes, it is
KRS?
KR Hospital, right? KR Hospital.
KR Hospital, that's the Krishna Rajendra Vadeyar Hospital in the name of the Maharaja of Mysore. And that's where my roots started.
Yes, absolutely. Absolutely.
What is unique about Bangalore? Bangalore is like Bombay or Mumbai, I should say, because the population density in Bangalore is as bad as Mumbai. So, what is the secret of Bangalore being uniquely different?
No,
Is it the climate?
climate could be, I mean, as a doctor you must tell us, because see, one thing that they all said was, the people in the beginning when this virus came, they all said, no, wait, because of the heat, summer it won't be, it won't really spread, and the heat would help contain it. But we are seeing that no heat and any of these things are not really working. If it is going up, it's going up.
Well,
Period.
if we are talking about heat, Tamil Nadu, when I went to Madras, it used to be called, it was like 110 degrees or so, especially on the coastal area. It's pretty hot. So I don't know if it's the heat that can really control the virus.
Yeah, see, now you, especially now with this, in the invisible virus, I have the novel coronavirus, all these words they have used, the novel invisible coronavirus. So the doctors have a huge challenge as to how to contain this. You also, being a doctor, I'm so glad that you're closely watching all this happening, sitting in Houston, but you have got a pan worldview. So that is what I'm excited about when you invited me to talk. So that's what I was excited.
Sure.
Now, coming to Karnataka itself, yesterday in the Hindu paper, this must be where sound very interesting to you, doctor. They say 96% of active cases in state asymptomatic.
That's amazing.
That's amazing. Now, whether it is really good, because they say that if you are asymptomatic, then you don't know whether you're going to spread or it's going to be safe. Now, there's a debate going on about this also. So now they say,
okay, I have something to share as a doctor, because I have done extensive research on this coronavirus, because I'm in the process of writing a book on COVID-19 pandemic. And what is interesting is that, in China, 80% of them were mildly symptomatic or had no symptoms whatsoever.
okay,
Whereas the 20% have, mild to moderate symptoms, and about 5% of them end up in the critical care unit.
Yes.
So majority of the people are asymptomatic. Even in the United States, the numbers are close to like 80 to 90% of them are asymptomatic. In fact, the number of people who are tested in Texas, they're finding only about 5% of the people who have tested positive for the coronavirus, which is sort of good news and bad news. That means only 5 out of 100 have tested positive. That means the other 95% could be getting it anytime. So
Yeah.
that's a sort of a double-edged sword, as they call it. Go ahead.
Yes. Yeah. So see, now coming to the tests, that is the most important thing. Of course, there are statistics that is thrown around that India we need and so far 3.84 million tests have been done.
Mm-hmm.
So we don't know now whether we should. They say that all the people need to be tested. As you know, asymptomatic people need to be tested. They all said that this report says that the health minister said that all these people need to be tested. Medical education minister said that that he will discuss the possibility of reintroducing mandatory test and 14-day institutional quarantine. So with
Okay, let me speak on that point from an
yeah,
American,
yeah,
my perspective, not American.
yes,
I'm still from Mysore city.
yes,
Okay. uh,
okay.
I think sometimes we follow the wrong numbers for the wrong reason,
Ah,
because the number of positive cases simply reflect the percentage of the population we are testing. Like in India, you tested 3.8 million people. In America, they have tested 17.6 million people. The more people you test, the more positive cases you are going to get, because 5% or 8% of them are going to be positive.
yeah,
The death rates are also highly unreliable because it is subject to human error. It is subject to time because not everybody records the death in the same manner. And also collecting that data and all these are not actually reliable. The most
yes.
reliable index from my my observation is how many people are in the hospital on a daily basis.
Ah,
See, that
okay,
tells me the top 20% of the or the 15% of the population that is really sick, and that's the only thing that matters. The top 15 to 20% of the population who is really sick, who is in the hospital, are the ones who need the most resources from the healthcare industry and from the medical professionals. Yes, it is important to test as many people as possible and isolate them from the rest of the community, but it is humanly impossible to test 1.38 billion people.
yes,
China, tested like less than 500,000 people, and they contained it. The key is to stop the virus from spreading. That's the key thing. That's why maybe India was successful with the lockdown for not 2 weeks, 4 weeks. It was what, like 6 weeks or so,
yes,
and
yeah, yeah,
that really helped to contain the virus from spreading widespread. In fact, after this, towards the end of the presentation, I'm going to show a graph as to what's going to happen if you don't contain the virus and what happens when you contain the virus. Okay, let's talk about the economic impact of the coronavirus in India. How has it affected? As I said, I already showed you a graph where the Indian GDP was on a downslide from 2016, from a peak of 9.7% to 3.1%. And where does it stand now, and where is it headed?
See, I'm glad you asked me this question because I'm not an economist, so I can't even understand all these figures. Let me be very plain about it. I'm a
Yeah.
journalist, and as they say, a journalist is a generalist. So, but the point remains, Dr. Nikam, that we in our country, unfortunately, I have also just posted my take on read the fine print, not the attractive attention grabbing headlines. So we have to read the fine print. Unless you read the fine print, you don't really understand what it is. So, but you have these fine headlines, headline grabbings,
Yes.
and we, especially with what is happening, they manage the headlines. So that is one of the. Now you say that if you talk about 2016, we have been talking about a $5 trillion economy. $5 trillion, just
Yes.
like that. You just come out with some figures. Again, when I wrote in that, read the fine print and the not the attention grabbing headlines. There, I was reading about China, for instance. Now, what was China? China is, I believe, Deng Xiaoping, who was the supreme leader then, about 50 years back. He gave a slogan to China, and that is one thing that I always hide your strength, bide your time. So that was the slogan that Xiaoping gave to China: hide your strength, bide your time. So 50 years we were there
Yes.
after that China war. In 50 years, they concentrated on health, they concentrated on education, they concentrated on economy. Nobody knew what was happening in China. Of course, being a communist country, I don't want to be living in a country like that, even if it's one of the best. That's a different this thing. But the fact remains that they did their homework. Suddenly, then now you go to China, although many of the people have gone to China, say where they are and where we are. So unless we accept the reality, unless we see the writing on the wall, we look at it, we will never be anywhere as far as our country is concerned. And at the age of 65, all of us are 60 plus. So we should all be concerned about what is happening. The GDP rate now, with the just now, is I saw it is down to 1.9%.
Oh
So
gosh.
where are we? 9.2% in 2016, and now of course they will give you the excuse of the corona. This thing has given a good the help. I mean, it is helping them to again come out with all kinds of things, excuses, and all that. So this is what it is. Where are we? 1.9%.
Yes.
So we have to accept the reality. We have to. Now they say you boycott Chinese goods. Okay, we boycott. But then if the mobile phone I have, everything, the motherboard, everything is from China. Now you can't just say that boycott. Let us accept it. If you really want, build. Like yesterday, I was my neighbor's son, who is doing research in the Indian Institute of Science, was telling me that you need power to generate. And China, the way that China has power, even to do a motherboard, for instance, the kind of electricity that you need, we don't have. So these are the basic things that we need to do. We have a long way to go. So accept the reality. I'm not telling that you have a magic wand and if
Yeah.
you just leave it, it will happen. No.
Well,
Unless
we can do a talk on where India should go in terms of competing with the world economy. I
yes.
have written extensively on that one too.
Oh,
India,
good.
until it gets into manufacturing durable goods like cars,
Yeah.
televisions, electronics, you're
Yes.
not going to compete with Japan, China, Germany, or France for a long time. And that's where we need to be headed. Just
No, no.
using brain is not going to make you a lead country in the world.
Yes.
Okay,
Yes.
let's get back to the stimulus package.
Yeah, that's
How
what.
many
The next.
stimulus packages were given
No,
and what impact it has made?
no. Like there were five tranches, as they called it. All these fancy sounding words, economic words. You have five tranches. The finance minister came every day in the evening at 4 o'clock, and they gave, and finally it amounted to 20 lakh. How many crores? 20 lakh crore plus. That is, I'll tell you, 20 lakh 97,053 crore. So she gave a little bit extra. So, and it is 10% of the GDP. But
10%
again,
of the GDP, yeah.
yes, 10% of the GDP. And again, as everybody said, the devil lies in the details.
Yes.
So there is so much about this so-called the stimulus package of 20 lakh crore plus. But when you really, boil it down and, break it down, then you know exactly what it is. And again, you are surprised. Why can't we accept things? Why can't we accept the economists, real economists speaking? You are not ready to listen to anyone. So unless, there was a beautiful article, consultation. We need to consult. We need to kind of talk to people like you who are concerned about our country.
Yes.
I mean, one example I'm giving, there are people, you have to keep your ears and eyes open. Now you just a bombastic 20 lakh crore, 10% of the GDP, but You talk to the economists, you talk to the experts every day, every single day. I read a lot, but as I told you, I'm not an economist, so I can't be giving
Yeah.
you all those figures. But the fact remains that we understand that what has been given to what is there. For instance, the MSMEs. You go to, I talk to the MSME, micro, small, and medium enterprises. They are called MSME.
Yeah.
But you see, Bangalore is one of the largest MSMEs in the world. But many of them had closed down even before the coronavirus, not now. So now again, I don't know where we'll be going. Everything, the prices have gone up. So many things are happening, but they say we will give you. You can go, and the government in the stimulus package has said that there is no, you don't need a collateral. You don't need a
Yeah.
collateral. So the government is ready to stand the collateral for you. But you go and talk to the banker. You go and talk to the MSME. The bankers are scared to give you money. There is the banks are flushed with funds, but they are scared to give, because finally, if you give and if the money is not returned, then the bank manager will be held responsible.
Yeah.
So these are the real issues. Where is the money? What are we talking? Where? And it is not just that. Till now, no money has come. The auto fellow, for instance, the auto fellow was supposed to get 5,000 rupees. Go and talk to any auto fellow man. They say you download that, you download this, nothing.
Yeah, in fact, I was going to ask you, how much did the common man get at the end of the day? Because you're already 8 weeks into this coronavirus cycle. And if people who are totally dependent on daily income, how are they going to be able to survive?
No, see, see, there are people now, there are suicides, as it is, farmer suicides has always been high in our country.
Yes.
So that is one area, agriculture. So what are we really doing with the farmers? And the what is called the unorganized sector, for instance, the auto rickshaw drivers, the maids, they are all unorganized sector. We don't, and the most important thing I forgot to tell you, this the stimulus package, you know what it is called? Atmanirbhar Bharat Abhiyan. Atmanirbhar Bharat Abhiyan. That is, you have to be self-reliant. Dr. Nikam, your father, my father, they all became self-reliant long back. They started their own businesses, more than 50, 60 years ago. They did well for themselves. We all, your father educated all of you. You had a large family. Of course, my father, us was a small family, but still, in whatever little my father earned, he educated us. So, the Atmanirbhar, self-reliant India has been. The unorganized sector has always been an Atmanirbhar.
Yes. See, it only has to start from inside. You can't rely on stimulus packages and all this. It's like taking morphine for appendicitis or gallbladder attack. You really need to fix the underlying problem, which is get the economy up and going.
See, for instance, why the stimulus? Why do you need? Because these are unique times. For instance, now the world has come to a standstill. The whole world is frozen, literally. So these are what happens to our taxes. See, whether even a maid, when she buys something, there are indirect taxes, and India's indirect taxes are, whether you pay income tax or not, everybody is involved in paying indirect tax. Yes. So there is so much petrol on so much tax on petrol, so much tax on aviation fuel, everything. And if you buy a car, it is about 70 or 80% tax. So what are we talking about? Taxes are there, road tax, that tax, this tax. We have taxes now. There is so much of money. So so that's what the experts say. These are the times when you need to hand holding. Hand holding is required now for the poor, for the migrants. Yes. This is the time. You cannot be asking questions and telling, as everybody said, give them money, give the migrants the money, give the poor the money, put the money in the hand so that they will spend. That's what every economist is talking about India. But is it happening on ground? They are coming out with their own explanations.
Well, giving money is not going to stimulate the economy. What stimulates economy is labor, production, and products. I mean, that's the engine of the economy. Your labor, your products, and your services, these are the ones which really produce revenue. And create opportunities for jobs, things like that. So let's change gears and get a little more optimistic here.
Okay. Yeah.
Let's talk about this Arogya Setu app that's been
Arogya
thought about.
Setu app, again, it's as we all know, it's one of the things that that has been introduced in our country. It was launched on April 2nd. The Arogya is health, and
Yes.
Setu is the bridge. So
Yeah.
you bridge the health. So what is it? It is contact tracing. I saw some reports about. I don't think you have an app like that, or I don't know whether you have introduced it.
Well, Germany has an app to track all active corona cases.
Yes,
Because
there
I studied German approach to the coronavirus, and they probably have one of the best ones in Europe. And plus, Germany has a national healthcare system where all the data is tracked already. So they also had an app to just track active infected patients so that they can keep these people from, mingling with the rest of the population. And that's why they have been very successful in Europe to keep their numbers low, even though, they had a substantial number of cases, close to over 200,000 cases. Yeah.
Yes, but I read that even South Korea has been very successful in
yes.
app. No, but as far as coming to India now, again, it is good that it could happen. But then again, the kind of population we have, that's what they say. The app is available in 11 languages, and all central government officials, including the outsourced workforce, have to download this app. So it has become it has been made mandatory. But again, there are so many concerns raised about this app.
Security and things like that. Because I read an article about some hacker, getting hold of security and putting this information on public media.
Yeah. So if you ask me, I have not downloaded it. The main reason.
In fact, anybody visiting India from any other country have to automatically have to register on this app.
You have to. No, but this is what let me again, because unless we see the the writing on the wall, as I said earlier, and we accept reality, this is what they say. One thing though seems to get clear: the app data in itself will not do much tracing and containing coronavirus infections, because the scale is just too big, and particularly so in India. No amount of data can automate the whole process. Jason Bay, the product lead for Singapore's contact tracing, best captures it in a sentence. You cannot, in quotes, big data your way out of a no data.
Yeah. Well, I think it's good to track these things, but they don't really make a major impact as such as, keeping people from mingling or not using self-mitigation procedures that it's been really taught in the United States. Even as we open up the businesses even as we open up the economy and we open up the businesses, we strongly recommend we should keep all those self-mitigation steps like wearing a mask, keeping 6 feet distance, washing hands, and things like that. So I also read that in Pune, I think they were on the verge of testing the vaccine, and then I find there are 2-3 other companies which are working on the vaccine. Maybe you can tell us what's going on there.
Vaccine, of course, now we have a couple of companies. I believe one is Bharat Biotech International, which is doing something with ICMR. The other is, and of course, we have one in Bangalore, Biotech. So they are all trying with the vaccines. But as all the experts, and including you, I'm sure, will say that this will take a minimum of 6 to 12 months or more to come out with a real vaccine. And as they say, if you have to vaccinate 1.38 billion people, imagine when you are going to vaccinate all of them. So these are huge challenges. But the fact remains, they also tell me, Dr. Nikam, because see, in India, the best thing that happened was we all had vaccines for various things. The BCG vaccine, for instance, they talk about. And that is why we have better immunity is one thought that is there, one argument that is there for the less number of the coronavirus cases in the country. Do you have anything to say on that? Because we have, the cholera, the
Yes, yes.
malaria. These, when we were young, when we were children, we were given vaccines right from then. So,
In fact, even now in India, given the living conditions and all these things, we, we are exposed to a lot more pathogens, viruses, and bacteria than in
yes,
the Western world, where we are living in an air-conditioned place.
yeah.
So it does make a difference.
Yes, there is a beautiful proverb in Kannada. Mane maklu kodatru, bidi maklu beladru. That is, the children living in all this.
Streets.
The children living on the streets grow. They grow.
Yeah.
They grow in the sense they develop better than the children living in the air conditioned comforts or others, because and they decay.
Yeah,
That's
that's
the
true.
word.
Yeah.
Decay. So if you translate literally, then it's a decay. So our country is unique in many respects. Impossible. You cannot.
Yeah.
The more you look at our country, the more it's a country of paradoxes, as my dad always used to say. It's a country of paradoxes. So many
Yeah.
things.
Okay,
You
let's
know.
talk about, India rescued Indians
Ah,
from all over the world,
yes.
and people are questioning about the people from our own country, the migrant workers who were left stranded with no food, no transportation, no shelter, nowhere to go.
Yes.
How is the India government of India addressing this?
Yes. See, now again, I wrote another piece, on the Facebook. Nowadays, I post my ideas on the Facebook, called the invisible mass appear on center stage at last. The
Hmm.
invisible. They were
Yes.
nobody thought of when the lockdown was announced on March 24th. Just 4 hours time was given. One of my friends, she's an author also. She has worked extensively with the migrants. So she was telling me, the moment this was announced, I was thinking, oh my God, what is going to happen to all the migrants? So, so what happened now? Before that, the people, who were brought back from other countries, the stranded Indians
Yeah.
under the fancy
Hmm.
sounding name called the Vande Bharat.
Yeah. Mission.
So again, this Vande Bharat, all these things, So anyway, that is what this thing is. Again, as you said, we should not be talking too much about it right now. But the fact remains that there was, and in fact, there were students in a place called Kota, Rajasthan, where students go for their 12th standard to go to IITs and other entrance
Yeah.
exams they write. So there is this big tuition factory in
Hmm.
Kota, Rajasthan. So all these students were stranded there. So many
Hmm.
people, the buses were sent from UP and other places to, ferry them back to their hometowns. But as I told you now, the coming to the migrants, it is a very sad thing.
Hmm.
But again, there are conflicting signals. When you talk to people, I do talk to a lot of people.
Yes.
If you talk to builders, because one of my other friends who has a coffee estate in a place called Kodagu district,
Hmm.
which is known for India is known for its coffee, and Kodagu is the place where you get the best coffee. So he was telling me that the reason this the government cannot be held responsible for it, because the builders, the building lobby, the builders lobby, they are the ones, they are all become billionaires, so they could have taken care of these people. But then when I talk to a builder who has been a president of a couple of associations, he tells me, no, Niranjan, in Mysore, if you see, all of us took care of the
Hmm.
migrants. We all
Hmm.
put them in a camp. We fed them. We even gave them booze. Then, and this is what he said, which was very interesting,
Hmm.
especially when we talked about the religious, the congregations and
Yes.
all that. So he told me something very heartwarming. He
Hmm.
said there were many Muslims amongst the labor.
Yes.
So they said, they all had lost hope because they would not be able to celebrate Ramzan.
Hmm.
But so they did give money for Ramzan. But the best thing, I don't think we have heard it anywhere. The migrant labor said, no, sir, you will give it back to charity. We are not, celebrating Ramzan this time. So I think instead of that, if we give the same money to charity, more
Hmm.
people could. Now, what more better example
Yes.
of the communal harmony? I think this especially this particular example should be highlighted everywhere.
Yeah,
So you
we are having a racial
yeah, you
debate
have
in the United States,
thank
which from
exactly.
coronavirus, New York, fifth city, which was totally empty, has
Yeah,
been turned into a riot city in
as
a
of
matter of 8 weeks.
yeah,
It
in a
is
matter,
amazing as to, how the world can change
yeah,
upside down.
yeah,
Excuse me, how it can change in a matter of weeks and days.
absolutely,
Let's move to the next point, and that is I'm going to bring up this graph so we can. Okay, here is the number of new cases, and I gave you the brief introduction. Let's talk about what do you see and what do people, the experts in India, see is the future of the coronavirus epidemic in terms of when it's going to reach the peak and plateau, and when you're going to see the decline.
huh. Uh, See, as the most stringent lockdown in the world,
Yeah.
the 1.38 billion people just froze. They came to a standstill. So it was all very fine. And as I always have been telling you from the beginning, we thought that it's going to end. 21 days, you just hang on in your houses, everything will be all right. That was what our leader said. But now the experts are telling, for instance, the main thing is the experts said what you have done with the lockdown. This is, these are not people speaking in general. They are not independent doctors or somebody like that. These
Yes.
are people of these various associations like Indian Association of Preventive and Social Medicine, Indian Public Health Association, Indian Association of Epidemiologists. They all gave a joint statement. They all said that the current situation in India with regard to COVID-19 cases could have been avoided had migrant workers been allowed to go home before a lockdown was imposed. So this is not this. If I tell, they will say you are that, you are this. But these were from the government. They are all members of these associations of government. You
Yeah.
know.
Well,
So
I can give a similar corollary to that. When the planes from China were stopped on February 1st, and Trump had to do this against the wishes of the entire administration and in the country and the opposition. And they were still, concerned that nothing was done earlier. Steps were not taken soon enough. So I think looking backwards, we can make a lot of. It's called the Monday morning quarterbacking in America, where you sit
yes,
back and say, you how beautifully you can play cricket on a Monday morning when you were not there in the field, a Sunday afternoon when you were losing left and right.
yes,
So
no, but yeah,
go
no, but
ahead. Let's
no,
talk about what.
no, yeah, no, yeah. So the question again, can you repeat? I'm just
Okay. What do you expect? What do the experts in
yeah,
India
yeah, yeah,
feel is the
right.
course of this coronavirus?
No,
It's been
right.
almost 3 months now,
It is
March,
3 months
April,
now.
May, and
Yes,
we still haven't seen the Mount Everest peak.
yes. No, now this is what you as a doctor needs to, which you have been, during the course of our conversation. Now we have been telling time and again about how these things will peak, and once it peaks, the graph coming down, it will take a much longer time than
Yes.
the peak it reaches. So I don't know whether a country has still reached this peak simply because now, as you said, the the people from Maharashtra, for instance,
Yes.
are coming back to Karnataka.
Hmm.
Okay, so every time they come a new case.
Yes.
Just yesterday, day before yesterday, two people came from Maharashtra, a pregnant lady and her mother,
Hmm.
just 2 days back, and they were tested in Bangalore. They came to Mysore. They now the results turned out positive.
Hmm.
Then they live just about 3 kilometers from where I live right now. So that
Hmm.
whole area is now cordoned off.
Oh.
It's become a containment zone. So So we don't know, especially with people moving around. Before I forget, I would like to ask you this question about what's happening there. What is the kind of movement that happens from, say, from New York to New Jersey, from New Jersey to Boston? Is it?
Actually, there are no travel restrictions as such uh, in place because we have flights going from one state to the other. They were talking about, like shutting down the borders, but it hasn't actually happened. But indirectly, they were saying, like, if you're traveling to Texas, if you're from out of Texas, they would stop and ask, why are you coming? Unless you're coming for a medical reason, or you are one of the public health workers or healthcare workers, they're going to question, why are you traveling? That was during the peak time of the lockdown in Texas. But otherwise, the flights were still flying all across the country from state to state. But the people movement was severely restricted, at least in the month of April and towards the end of May, I should say.
Yeah. So, but that could be because it was self-induced. Like all of us said, we are not going to travel. There's no point because you're risking too much if you're going to travel. But in our country, there is travel restrictions even from one district to another.
Yeah, I see. Yeah.
So why one district inside the district from a red zone? So we have all these zones, red
Yeah.
or. So you have, especially if you are from a red zone, there is no way. If for instance, one of my friend's son was came to Mysore and he was looking after his parents. My friend who turned gone blind, so he had their own issues, lot of issues. But he came and helped him. Now after that, when he went back to Kolar, KGF, where he works, then he was under 14-day quarantine.
Yeah.
So this quarantine, see again the institutional quarantine more than the home quarantine, and that is the fear psychosis that has set in.
Yes,
So people, the moment you say you are going to be quarantined, especially institutional quarantine, the kind of things, the stories that we hear about in institutional quarantines, everybody is scared to go to a government hospital if you are quarantined there because they are not sure of the facilities. The toilets are stinking, the food is bad. So many things like this. At least home quarantine, I don't know, because now these two women, they have been home quarantined. At least in your own home, you are much safer. But quarantine, even if you are asymptomatic, then you might get the disease is what the fear is. So again, these are issues now. It is going up. We don't know, as we were having yesterday in our discussion. So you said that this could be another 6 months. We have still not seen the heights in our country. Is it really going to go up, or are we very lucky that it is going to stop right here and it's going to plateau down?
Well, let me tell you from a medical perspective and with scientific background, based on Wuhan, New York, Germany, Italy, all these different countries. This is not going to disappear tomorrow. I can guarantee you that. With almost 8,000 new cases being detected, and if you test more people, you're probably going to see more. But a few observations I would like to make is in China, it took about 2 weeks. In New York State, it took about 4 weeks, and still it took them twice as long. If this has taken 90 days to see the peak, and let's assume this is the peak of the cases, you still have to see a plateau, and the downslope is going to take at least 2, maybe 2.5 times this. So you're looking at 6 to 7, 8 months. So it will be November, December before you can see the graph coming down like this towards the end of the cycle. So that's law of nature. I'm not making it up. And there is scientific data based on the Chinese experience and based on many European countries where I have talked about different graphs from UK, from Germany, from Italy, and even Sweden. So that's what's going to take. I think I may have another. Okay, here, can you see this slide here on the left?
I can.
Okay, here is a slide, what is called flattening of the curve.
Yes, flattening of the curve.
Flattening of the curve is a term used.
Again, a fancy term that was started right in the beginning, flattening the curve. We are going to flatten the curve in this my time. Okay, go ahead.
Okay, if there is no lockdown of any kind of mitigation taken place, they predicted there may be several million people who would get infected, close to 10, 20, 30, 50 million people. There will be like 3 to 4 million deaths. But they predicted that if we do the lockdown, and then this cyan color in the bottom is the capacity of the healthcare resources. Even then, as you can see, the New York exceeded its ability to deal with the healthcare resources, and they had to be supplemented from elsewhere. So they had to get like 20, 30,000 respirators, ventilators, things like that. So looking at the Indian graph and looking at the population of India of 1.38 billion people, I will have to conclude, based on my observation, looking at India compared to Sweden and other countries, that in fact, India has been able to successfully flatten the curve. There is a plus and a minus when we flatten the curve. When we flatten the curve, as you can see, it prolongs the time it takes to reach the peak. And it also takes a much longer time to come down. So that's why I think, given the population size, given that the number of active cases are similar to New York State, which has maybe less than 40 million people, we have to say this is a flat curve if you look at the population size. And obviously, this is a good response to what India has done in terms of mitigating the spread of the coronavirus. As a result, I think it's going to take a little longer time for it to reach a plateau, and for it to come down like this. Maybe it may come down rapidly, as it is shown here, but nonetheless, I would say anywhere from at least 4 to 6 months would be my guess before the FOR curve, or the bell curve as it is called, that will come towards the bottom. So that's my sort of a crystal ball prediction based upon what I have observed on the charts in China and Europe and in the United States. Any final thought?
Yeah, my final thoughts is that, as you said, another 6 months, but hopefully, a country like us can't afford more lockdowns. We had lockdown 4, and now what is called the unlock has started. So we hope, even if these things peak, people will not be put to hardship. Somehow we have to live with it. And the last point is, most of the experts say that we have to live with it.
Yeah, I think you make a very good point. I think we have done enough of lockdown that we can accomplish. Along with the human death toll, we have to look at the economic toll on the entire country, because as a country, you have to look at the overall health of the country, not just people itself or just economy, but the entire package together. So I think it's time for us to return to work, but follow the same strict self-mitigation rules. So that's the best we can do, and hope maybe in 6 months we might have a vaccine, and hopefully that will help us to contain this COVID-19 pandemic. 1919 and 1920. Niranjan, it's been a pleasure talking to you. Ladies and gentlemen, you have been watching a Triple N talk show. I am Dr. Nik Nikam, and we have been coming to you from Houston, Texas, and also from Mysuru, Karnataka, my hometown.
Another Triple N. I am N Niranjan Nikam. They call me Triple N.
There's 2 Triple N's. Thank you so much, and I will talk to you next time.
Yeah, sure, Dr. Nikam. Thank you so much. Again, hope this is one of the most lovely conversations that I've had. And I'm proud of you, because you have been a doctor, but now you have become an independent journalist, and you're following your passion. That's what my late brother Girish Nikam always used to say. You have to reinvent yourself, and you have been reinvented. And this Zoom thing that has happened now, we have all reinvented ourselves.
Yes, absolutely. I think we have to live it to really experience life.
Yeah,
that's what I think.
Yeah, exactly. Thank you so much, Doctor. Good day. Yeah.